All right, well, we're going to go ahead and get started. Thank you for everyone who's able to participate in this. This is a webinar. My name is Brendan Griffin. I'm the Deputy Director at Texas Appleseed, and we're going to be going through some basic facts about one of the programs from the American Rescue Plan Act, and be telling you a little bit about some of our recommendations for how these funds can be used. So we'll kind of, and we'll have a, I'll go over some basic information about ARPA as it's known. Our recommendations will be split between several of us at Texas Appleseed. We'll have a Q&A, and then we'll talk about what we can do with some of this information and how we can work to use these funds to make Texas a better place. So yeah, Texas Appleseed is a public interest justice center. Our mission is to promote social, economic, and racial justice for all Texans by leveraging the skills and resources of volunteer lawyers, other professionals, and community partners to identify practical solutions to difficult systemic problems. It's a bit of a mouthful, but we work on a large variety of issues, and we try to work closely with partners around the state to improve lives in Texas. So the American Rescue Plan Act was signed into law earlier this year by President Biden. It was $1.9 trillion in total, which is quite a lot of money. And then it included things like the third stimulus check that went out to individuals, funding for public health, school funding. And then we're primarily talking about a program that's aid to states and local governments. So this is funding that will go to the state of Texas, and then also many larger counties and cities throughout Texas will get their own pieces of funding from this to decide what to do with. So this particular pot of money, there's, just to mention, there's, like I said, there's several other pots of money, but this is the Coronavirus State and Local Fiscal Recovery Funds. The U.S. Treasury is overseeing this, the federal agency that's going to provide oversight. And the purposes are pretty general. The purposes are to support urgent COVID-19 response efforts. It's replacing lost revenue for eligible state, local, and tribal governments. So this is, since taxes went down in many places, tax revenue went down in many places. Fewer people were buying things, property taxes in some places fell, things like that. Many states and local governments lost tax revenue. So this is in part to replace some of that funding. But then also to support immediate economic stabilization for households and businesses, and addressing systemic public health and economic challenges that have contributed to the unequal impact of the pandemic. So, you can fit a lot under that very general list of things. And we'll talk a little bit about some of the ways we think that should be used. Just kind of give you a sense of the scale, put together this little chart. The state of Texas is receiving just about $16 billion in funding, which is pretty significant. Cities and counties are receiving hundreds of millions. So Harris County is receiving the most of any local jurisdiction. They're getting almost $1 billion by themselves, which is still quite a lot less than the state of Texas is getting, but it's pretty significant. Houston comes in second. The city of Houston comes in second at just over 600 million, and you can kind of see how it goes down from there. There's a complicated formula based on population and need and things like that that governed how much went to each kind of entity. And this is significant money for most of these cities and states, cities and the state. This is the city of Austin. One of the ones I'm most familiar with has about $1 billion in general revenue. And so they're getting almost $200 million additional to spend over several years, but that is quite significant amount of money for a city it's almost 20% of their annual budget. and their annual budget is pretty much spoken for most cities and counties. Almost from the beginning, they usually don't have a lot of extra funding to put into new programs or new expenses. And so the ARPA funding really does give these groups a chance, these cities and counties a chance to start new programs that can have significant impact, or do infrastructure that's like one-time spending on building new things. So, all right, next slide. Okay. So there are some time limits involved. So this is one-time money. We're not expecting there to be a lot of any additional money. The money has to be obligated by December 31st, 2024. So basically in 3 years, they have to have decided how it's going to be spent and sort of written it into either budgets or have contracts out worth the entire allocation. So they have about 3 years to sort of decide how to spend it. And all the money actually has to be spent by December 31st, 2026. So they get 2 years after that to kind of finish spending down everything that they've committed to. So this has a lot of implications. I mean, it's hard to use this money to start up long-term programs, big programs, because the funding will go away in about 5 years. So you want to have programs that are going to have some sort of sustainability or be really focused more on one-time expenses, so that you can you're not, if you hire a bunch of new people, you're just going to have, the city or county will have to lay them off or find other sources of revenue for them in 5 years. So that's what that means. So just every city and county in the state are all operating on different timelines on how to decide how to spend this money. The state it's part of the call for during the special session that they're in right now. That special session ends at sort of late October. I think October 20th or thereabouts, maybe October 19th. So they really have about 2 weeks where they're supposed to decide how to spend the state money. And over the weekend, or maybe it was on Friday, Senator Jane Nelson put the first sort of proposed bill language out about how the state will spend that money. And they're spending about half of it on unemployment insurance and sort of basically a fund so that they don't have to tax businesses more on unemployment to use it. But then they've also got investments in broadband and for schools, for higher education, stuff around coronavirus, sort of public health spending, things like that. So it's pretty wide variety of spending being proposed, and they have a couple weeks where I'm pretty sure some changes will be made. I don't know how many will be made. So, and then cities and counties have to decide on their own how they're going to spend this money. And so the cities and counties I've looked at are using it in a real wide variety of ways. Some of them are going through public input processes where they're trying to like get ideas from the public and see what has the most support. Some of them are just making proposals and starting to spend the money right away. And it just kind of depends on what that city or county wants to do. And given that this funding is very broad and that they have a few years to spend it, some of them are kind of taking their time on deciding exactly what they're going to do. Most of them seem to be taking, at least the big counties and bigger cities that I've looked at, are looking at sort of putting the money into buckets where they're not talking about the specific programs yet that this will fund, or not all of them have real specific programs, but they're saying we're going to spend, $100 million on reducing homelessness, or we're going to spend $25 million on mental health treatment and substance abuse treatment, and we'll spend $20 million on pandemic-related public health expenses. So those are the kinds of things they're saying, but they're often not saying we're going to build a mental health treatment center next year, and that's what our goal of using that money. Or this is the exact kind of homelessness reducing program that we're going to do, whether it's new housing or rental assistance. A lot of them haven't gotten to that level of detail yet. So there's still a lot of room to sort of advocate for changes and to make a difference in how these cities and counties will spend their money. And many of the decisions, but not all of them, will be probably made in the next 2 or 3 months as the money gets sent to particular departments in the cities and counties, and those departments really figure out what programs they're putting it into. So we have some principles around this that sort of guide all of our recommendations. And our general principles are here. We think that equity first, the actual language of the American Rescue Plan Act mentions the overcoming some of the inequalities that the pandemic made worse. And so that needs to be front and center for every plan that every local government comes up with. They need to also plan specifically to track things and say, these are the impacts on the different groups involved. This is what we think the impacts are going to be around on the different economic groups, different racial groups, and see who's being advantaged and who's being disadvantaged by the way that these funds are being spent. We know that African Americans had a lot worse outcomes throughout the pandemic, and inequality worsened. The racial wealth gaps, racial health outcomes were all impacted by the pandemic. And so we think that this needs to be tracked, and really the programs being developed need to address this directly. We think it should be transparent. This is a lot of funding. It should not go into black holes where nobody ever knows how it's spent or what it gets spent on. And it shouldn't be a long, complicated process of like requesting information from the city or the county to get this information. This should be out on public websites that are easy to access and easy to see how the money's being spent and what the impacts have been. And then evaluation and adjustment. For the programs that are going on long enough, you really need to, we think that they really should be, especially if it's a new program, they need to see how it's going and just make sure that they're making adjustments as they go. And then I'll just mention, just in terms of good government, most of the expenses we talk about here are either one-time expenses. They can be that one-time expense, so you're not starting a program that's going to end in 5 years when the money runs out, or they're programs, piloting new programs and looking at how you're going to sustain them over the long run. So we try and really identify that as something that needs to be done. We will not have a strong recovery if it is not an equitable recovery. It's not going to actually be a recovery unless we have equity. So with that, we're going to get into the actual recommendations, and I'm going to turn it over to my colleague, Maddie Sloan. She's our Director of Fair Housing and Disaster Recovery, and she'll take it from the next few slides.
Thanks, Brennan. COVID-19 is a disaster. And like all disasters, it has a really disproportionate effect on certain communities. Generally communities that have been put in really vulnerable positions by, a history of disinvestment and discrimination. And that, while horrible things can happen to anyone in a disaster, a lot of the disproportionality is around ability to recover. So our first recommendation is that this money should be used for direct cash assistance. Because when people lose jobs and they lose income, they need money. And people know what their own most urgent needs are, even if they don't fit in with some of the established programs. So if you need car repairs to get to work, if you need diapers, if you need funeral expenses, unfortunately, there should be assistance for that, that people can determine how to use in the way that's most urgent to them. And this is data from the Census Household Pulse Survey, which has been doing an ongoing series of surveys during the pandemic. Right now in Texas, 35.7% of adults are in households where they've had trouble paying their usual household expenses. People have put off medical care, and people are hungry. There's a very high level of food scarcity, and it is in fact higher in households with children. And because there are a lot of sort of terrible and largely racist stereotypes around how low-income people spend money and benefits, this is how renters in particular spent the first stimulus, the $1,200 checks and enhanced unemployment from the CARES Act. 83% spent money on food, 81% spent money on rent, and 67% spent money on utilities. So people need money to meet their basic needs. The next recommendation we have is for rental and mortgage assistance. Our partners in Houston, the Home Coalition, did interviews with directly affected people, and this was the #1 need that they identified. Stable housing is essentially the basis for a lot of other life outcomes, but it's particularly critical. Keeping people housed is particularly critical right now, to prevent COVID spread and deaths. The Delta variant is actually more contagious than the first variant. It prevents increases in homelessness. It reduces the long-term consequences for families, which can be really extraordinarily negative. And while this program is usually talked about as a tenant assistance program, this is really landlord assistance. The landlords are the people who are getting paid with this money. So again, this is Household Pulse survey data. 35.1% of adults said they were not current on rent or mortgage payments, and they anticipated being evicted or foreclosed within 2 months. So that's over 500,000 households. That's at least 1 million Texans who are at risk of eviction. Which Texans are most at risk? It's the same people who were most at risk before the pandemic and who have been disproportionately affected by the pandemic. We have an affordable housing crisis in Texas. To afford a 1-bedroom apartment at fair market rent in Texas, you would have to work 2.5 full-time minimum wage jobs. Black and Hispanic Latinx Texans are disproportionate risk of both having an eviction filed against them and actually being evicted. That's very disproportionate. And households with children are disproportionately likely to be actually evicted, to have a judgment filed against them, as are survivors of domestic violence and women, particularly women of color generally. So, eviction has a lot of negative long-term consequences for both individuals and communities. So, for individual families, it increases negative health outcomes, it increases poverty and financial instability, it increases school instability and has a long-term effect on children's academic outcomes. And, an eviction case, essentially goes on your credit report and can prevent families from getting new housing 7 years later. Even if the case didn't go forward or the tenant won the case, that eviction filing is on their record and landlords screen for that pretty aggressively. So, in the community and for the whole state, we calculated how much a million people being evicted would cost, and it's more than $1 billion. Also increases in homelessness, increases in COVID cases and deaths, not just in the most affected communities, there's a spillover effect. And the increased poverty, increased bad health outcomes, is a community level crisis, not just an individual crisis. Our next recommendation is investing in permanent supportive housing, which is permanently affordable housing that generally comes with wraparound services to help people maintain housing, often to move out of homelessness, but not exclusively. Again, we are in an incredible affordable housing crisis. There is not enough housing, and the main reason people are homeless is because they cannot afford housing. Homelessness has been increasing over the last 4 years, even pre-pandemic. But the pandemic has made the crisis worse. For the first time, veteran and family homelessness did not decrease. In part because of the risk of COVID, the number of single adults who are sleeping outside, living outside, exceeded the number of people living in shelters for the first time since the HUD point in time count started. And over the next 4 years, chronic homelessness is expected to increase 49% nationally because of the COVID-related recession. Again, it is incredibly critical to keep people housed, to get people housed, and to ensure that housing is stable in order to prevent negative outcomes for individuals, for families, and for entire communities. And next, our Pro Bono and New Projects Director, Gabriella McDonald, is going to talk about some of our recommendations for children and families.
Thank you, Maddie. So these are the recommendations for children and families, and I'll go through each of them fairly quickly, but they have some overlap with some of our other things. So next slide. The first one, of course, is supporting youth and young people who are juvenile justice involved. We know that being the facilities that we currently have throughout the state, and I believe there are 5 of them, are not very beneficial to youth and not very helpful in actually preventing recidivism and making sure that youth are not being made worse by being put in state-based facilities. And so what we saw during the pandemic was actually a 25% decrease in youth incarceration between March and October. And part of the reason for that is that facilities and DAs, prosecutors were really forced to think about whether a youth was actually of any danger to the community. because being inside of the facility was so incredibly dangerous and remains so incredibly dangerous because you're in close quarters. And what a lot of the facilities actually did was they actually tried to isolate a lot of the youth by themselves, which essentially put them into a form of complete solitude, which was really, really hard for a lot of youth, and actually makes youth a lot worse in dealing with trauma-based issues. And so what we saw during the pandemic was having that decrease of 25% of youth being released from these facilities and allowing them to be treated in their communities. And so when youth are in facilities, the facility, it costs that $442 a day that you see on the screen. But programs that are community-based that can include anything from jobs programs to education and tutoring to access to mental health supports to community service and probationary programs that are available within youth's individual communities, allowing them to have access to their family, to their friends, to their support bases, so that they are not incentivized to recidivate, actually is way more cost effective. And so infusing funds into individual communities to actually support youth in their own communities actually will save each of these localities and the state money. Because if you're moving youth out of facilities that cost about $442 a day per youth and put them into communities, it could be anywhere from $30 to $80 a day. Right here, this number I have of $75 is from NEEKC, but there are a number of other resources that say it could vary just depending on what the program is and how youth are involved. And so because we have so many youth in our facilities compared to other developed nations, this can make a really big difference, especially in Texas, where we also just generally have a high number of people in juvenile facilities. Moving on to the next slide. So I mentioned some of the isolation that youth experienced in the juvenile justice system here in Texas and actually across the nation, but they were also limited from seeing their friends and family at any time. They weren't allowed to leave. They weren't allowed to have visitors. There was a disruption in their programming because staff would get sick or staff would have to stay home or staff's, basically their family would get sick or they would get sick. And there weren't opportunities for youth to continue the programs that were supposed to be supporting them within these facilities because everybody was in these facilities together. And if one person got sick, everybody got sick. And that was not conducive to actually making things better. And similarly, you're dealing with this issue of understaffing in these facilities in the first place, but we want to make sure that youth have access to professional counselors. And having youth being locked in isolation during the COVID lockdown prevented them from having that access and just exacerbated their trauma. And so if we can make sure that we are actively putting mental health supports in juvenile facilities for the ones that need to remain open, of course, we would love to see them closed so that kids are treated in their communities. But if we've got to keep them open, we need to make sure that they have the mental health treatment that they need in each facility. Okay, next slide. So I mentioned that some of the diversionary programs or community-based programs could be jobs related. And this is true for all youth. Youth need to be supported. They need opportunities to earn funds. They need to be able to interact and to develop all the skills that they need to be productive later on in life. And so there are so many long-lasting benefits that could be created from having summer jobs programs for youth. And some of this is, of course, going to require a lot of coordination on the part of government agencies, nonprofits, and businesses so that they can create programs that are really, truly beneficial for youth. And in addition to that, we're also going to want to make sure that they have travel allowances or public transportation options to be able to get youth where they need to go. But these summer programs could be really, really beneficial overall to individual communities, because not only are youth then involved in their local economy, but they're also spending in their local economy. And if these summer jobs programs are something that are juvenile justice supported, there's a way to make sure that those youth are also able to contribute to their local community and be involved there. And so all of that is a positive net plus for each of these local communities to invest in. And last but not least, on the children and families recommendations is the Child Tax Credit Campaign. So the child tax credit, for anybody who doesn't know, is partially refundable credit that allows low and moderate income families to reduce their tax liability by up to $2,000. So what the change happened for ARPA is that the tax benefit was upped by about $1,600, depending on the age of the child. And it also made sure that even if families are not filing taxes, that they have access to this benefit. And the benefit is being paid monthly instead of just on the file taxes. So the credit phases out depending on the adjusted gross income and whether you're filing singly or as a couple. And we're already seeing some of the financial stability that is happening based on the child tax credit that has been issued. And payments started on July 15th. And if you'll go to the next slide, you'll actually see some of that issue of food insufficiency that Maddie was discussing. The Census Bureau has been tracking that. And if you look at before the tax credit was issued, the very first payment was issued on July 15th, you'll see that adults with kids in the household had about 11% of them reporting some sort of food insufficiency. Literally in a 2 to 3 week period after having received their first child tax credit payment, they've seen a drop by about 3%, down to 8.4% of people reporting some sort of food insufficiency. You can compare that with the next two set of bars that say adults in households without children, where actually food insufficiency is having a small uptick because they're not receiving some sort of cash funding to support them and make sure that they can pay for the basic necessity of food. Next slide. Similarly, difficulty just paying general expenses. Maddie also mentioned things like diapers and, paying utility bills was a really big reason, a really big way that people use their first, direct cash payment that they received from COVID relief funds. Well, this is no different. The child income tax credit, where you see adults in households with children, they're actually reporting less difficulty in paying for some of those things, expenses that they have on a regular basis. Whereas people without children in the household who aren't receiving this benefit are reporting more difficulty being able to pay for all of the things that they need on a regular basis. Next slide. So what local communities can do is really raise awareness of the fact that the child tax credit is available and who it's available to. So we need to make sure that families know about the program, understand when they're getting their payment, that they're paying this payment monthly, that even if they don't file their taxes, that they can access this payment if they have children. And I have here the websites for both the direct IRS website and the Code for America website, because I've been told that the IRS website is a little bit difficult to navigate, but the Code for America website is a little bit easier. So that's the second link for all of you who are interested. And then just realize that the public charge restrictions that were put in by the previous presidential administration program have been lifted so that people who have green cards basically, or looking to get a green card, aren't restricted from getting their green card because they've used public services in some form or fashion. And so what we want to make sure people understand is that all citizen children can receive this benefit, even if they are in a family where someone is not a citizen. So if the child is a citizen, they have access to these funds, and somebody should be filing to get the money for the family so that the local community can benefit, including the individual family. And so I will turn it back over to Brennan to talk about some other community issues that the ARPA funds could help support.
Great, thank you. This is sort of our general ways that this funding could be used. So next slide. One thing that is specifically called out in the American Rescue Plan Act guidelines is that this funding could be used to expand broadband access. And while this sounds a little bit niche sometimes to people, this is really becoming more and more important. I mean, it's impossible, even if you have a school provided computer, it was impossible to get the lessons that you needed last year when schools are often closed by video unless you have broadband access. About 30% of Texans lack broadband access at all. And that really needs to be addressed. In many cases, it's about the physical infrastructure is just not there because it hasn't been worth it, worth the expense for, for-profit companies to go extend, wires basically into certain neighborhoods and especially more rural communities, but also parts of different cities that are that they don't see the profit motive there. So this funding can be used by cities and counties and the state to expand broadband access. And it looks like some of the changes brought about by the pandemic look like they're here to stay. I mean, I think telemedicine and especially sort of video calls with doctors, a lot of people expect that to keep on going. Interviews have been going on online, even for jobs that are more in person. So this is just an important thing to have in the as we move forward in the future. So next slide. Mental health and wellness first responders. Several cities in Texas are actually starting to pilot this and have small programs, and I think a lot of it, this has a lot of promise. So right now, about a third in some of the cities that they've looked at on 911 calls, as many as a third of the calls that right now police respond to could be handled without an armed police officer, and in many cases will be much better handled without an armed police officer. Police officers who, even those who are certified sort of mental health officers, maybe have an additional 40 hours of education on mental health, as opposed to an actual trained counselor, therapist, social worker who has a degree in that and has had to spend years often in training for that. And those folks are much better equipped to handle things like someone is acting kind of strangely and seems like they might be in crisis, but they're not actually doing anything threatening or violent. Or we're not sure this person over here is on the sidewalk and doesn't look like they're moving very much, and they look like they're pretty sick. Someone can come check that out. You don't need police officers for that kind of thing. And in fact, it's probably harmful in many cases. Some of the worst tragic incidents that people can recall of police shootings and police killings in the last few years have involved people going through mental health crises who don't appear to be violent when the call is made. And police officers tend to escalate. That's their training, and having people who are really better trained on de-escalation and have more skills for substance abuse and mental health treatment could respond to a lot of calls that are happening now. So this is at the 911 call, instead of just having police or fire or EMS, you would have an option of saying, it looks like we need someone with some mental health training or someone who can deal with substance abuse issues to come out and take a look at the situation. And these tend to be cheaper programs than police. Police are comparatively well paid. Doesn't mean maybe we should be paying our mental health and wellness folks a lot more than they are right now, but these programs do cost less right now than having police officers do that job. So there's a lot of different wins that you get with this kind of program. Austin, Houston, both have programs that are relatively small that we hope to see expanded. Harris County is starting a new program that is planned to get fairly large throughout Harris County, and then we would like to encourage other cities and counties to follow suit if they haven't already. Okay, next slide. Financial coaching. We talked already about the economic impact and the disparities in economic impact on families and households. And low cost or free financial coaching can be incredibly useful for families and improves all kinds of outcomes, just helping people avoid really high cost payday loans and understand their alternatives. Everything from not getting ripped off on a auto loan, a used car lot, to avoiding payday loans, to making spending plans and budgeting and that kind of thing. Financial coaching really help with all that. There are several cities in Texas that are part of an initiative to do this, and it's shown really promising results, and we think it should be expanded. Next slide. strengthening community development financial institutions. This is kind of similar in some ways to that, in ensuring or complements the previous one. It's ensuring things like credit unions and small community banks and those kinds of institutions have extra support so that they can give out the alternatives to payday loans. If your only choice in the place is, if you need $500 to go, fix your car or pay an electricity bill or, that kind of issue, and you don't see any alternatives to a payday loan, and in many places it's hard to find, then you go out and get the payday loan, and then you get trapped in these cycles of debt and higher fees and fines and fees involved with this, and it just can often send people into a spiral. But if credit unions and small banks that are called CDFIs can provide low-cost loans or give out more of those kind of low-cost loans as an alternative, these are loans that people can afford to pay back. They take into account how much money people make, and what can they really afford to make back over time. It can be help with home mortgages, all kinds of expenses like that. Even small business loans for getting something off the ground to help improve the small business scheme. So these are all things that our CDFIs can do. And this is actually not even spending the money often. It's often just establishing a fund so that they can take a little bit more risk and know that they won't lose all their money. The banks won't, the credit unions wouldn't lose all their money if they take too many risks. General mental health and substance abuse facilities and coverage. This is just tremendously underfunded, and the pandemic caused huge problems. Substance abuse overdoses have increased in most major cities, including in Texas, really significantly. The percentage of adults saying that they have some negative mental health outcome, like depression, anxiety, substance abuse increase. It went from 11% before the pandemic to 40%, and it stayed there throughout the pandemic. And so, we were already underfunded on this stuff in Texas, and it's already hard to find treatment, especially affordable treatment. And so we think that this is a really significant use of funding. And a lot of times, in a lot of places, you just need more inpatient and outpatient facilities. So this is a good use of one-time funding. But it also can be things like establishing increased coverage so that people have sort of insurance that can cover basic mental health and substance abuse programs. There's a whole wide variety of ways to do this, and most of them are very good, and we should just be using some of this money this way. So, funding and public defense. So we've seen a huge backlog of cases grow of people being accused of crimes and trials, and even plea bargains, which is the majority of how this stuff gets handled now. A vast majority of criminal cases are now handled through plea bargains. There's a huge backlog because courts shut down basically for several months, and even when they started back up, they had challenges around capacity because they didn't want to expose too many people. Nobody wants to be part of a jury pool if they're going to spend hours waiting in the waiting room to find out who gets called to be part of the jury during the middle of a pandemic. So we're going to need extra resources to clear that backlog of cases, and we specifically are pointing out that we need more public defenders or even appointed counsel for those who can't afford it in places where there isn't a public defender. And this is just clearing that backlog that would take about 5 years to clear at this point without extra resources. We don't call for extra funding for prosecutors. We think that it would be a mistake to add prosecution resources. Most of the time, there are many cases that prosecutors it's in their interest to just dismiss low-level nonviolent crimes, and many of them are still not doing that. And so instead of wasting more prosecutorial time on that, on keeping these charges going, they should just be looking at places where they can dismiss cases without impacting public safety and improving the lives for those people affected, frankly. So next. And now I'm going to turn it over to my colleague, Andrew Kirsten, who is our Director of Education Justice, and he's going to talk about some of the schools and related recommendations.
Thank you, Brennan. Good afternoon, everyone. Thank you for joining us. It's an honor to have you with us. So as we thought about the ARPA funding and the opportunities to direct all of those budget allocations from the federal government to local education agencies, to school districts themselves, we wanted to be very thoughtful and incisive with our recommendations. I think it reflects these ARPA recommendations, a framework that we have adopted over the past few years. Even prior to the pandemic, we recognized that there was just wholly inadequate funding to mental health professionals, let's say school counselors, school psychologists, school social workers, as compared to school police officers who appear on campuses across the state of Texas. So we wanted to adopt a framework for ARPA that really honored, I think, the advocacy that we had taken on, and wanted to really uplift the incredible suffering that young people have had to endure over the past 18 months, as we all have, right? So to really understand that students need robust support services in this moment, they need access to mental health professionals and to restorative practices that will allow them to navigate this difficulty through relationship building with each other and with the adults who are charged with their care. And really the priority of evidence-based resources in schools to ensure that young people have access to everything that they need to flourish academically, socially, and emotionally in this moment as the pandemic continues and in its aftermath, whenever that comes. We can go to the next slide. So in March 2021, we issued a report called Education Transform, the K-12 Experience in Texas during the coronavirus pandemic, that really examined the first year of the coronavirus pandemic and how it impacted young people. We start with a very 30,000-foot view to have understanding that food instability, housing insecurity, and even the demands of working could not be divorced from the experiences that young people were having in schools, even early on in the pandemic. And so we looked at all of these social issues that have really been highlighted during the pandemic and exacerbated, right? And then went down into how school proceeded, certainly at the end of the 1920 school year, but at the beginning of the 2021 school year as well. And what we found is that business as usual continued in all the wrong ways, right? There was no significant divestment from school policing budgets, even after the incredible wave of protests following the tragic murder of George Floyd. There certainly was the continuation of disciplinary referrals for young people, both through the virtual classrooms that they accessed and as they returned to school in person in various districts across the state, right? And this generally kind of zero tolerance, punitive approach to discipline was really governing how young people were experiencing school during the pandemic. And so with that, we made some very bold recommendations in Education Transform, really that there needs to be that significant divestment from school policing in districts across the state. And those monies should be reallocated toward legitimate student support services for young people and for those mental health professionals. I mentioned school psychologists, social workers, and counselors. For those relevant professions, their professional associations say that, let's say for school psychologists, there should be one school psychologist for every 600 students in a school. For social workers, there should be one social worker for every 400 students. And for school counselors, there should be one school counselor for every 250 students in a school across Texas. And in assessments that we've done leading up to the pandemic and even during the pandemic, we have found that those numbers are, woefully falling short, right? That in so many districts across the state, there are not adequate staffing numbers of those trained mental health professionals with expertise in child development to provide that support to young people, right? But again, in the place of those adequate commensurate investments in those mental health professionals, you have school policing, school security, school surveillance, right? That business as usual that is not truly serving young people in this moment of extraordinary suffering. We can go to the next slide. And so our advocacy extends across the state, but also locally. We wanted to uplift some incredible work that's going on with partners that we have the honor of collaborating with, like San Antonio Poder. Over the summer, kind of thinking about this 21-22 school year beginning, they tweeted out some really incredible demands for the San Antonio ISD Board of Trustees. And I think they provide a very helpful framework for how advocates across the state and directly impacted young people and parents can push their school boards and push their campus administrators to spend this money in a way that actually serves children and families, right? So Poder over the summer was pushing SAISD to adopt ethnic studies in all schools, a culturally relevant curriculum for young people, right? A trauma-informed and social and emotional learning practices for young people, into an over-reliance and overfunding of school policing, and real restorative practices in schools, right? And I think that 5-point framework speaks to so many things happening in the Texas political landscape right now. Folks might be seeing more and more conversations around critical race theory, both at their local school boards, right, and at the Texas legislature. And we recognize that even as SB 3 has passed, right, one of the bills that banned the teaching of critical race theory, among other topics of actual US history, right, as we thought about that during our advocacy, we know in our expertise with the school to prison pipeline, if anybody is going to be punished, right, for still pushing for critical race theory, right, which feels like a misnomer for what is actual US history, right, the Black and brown children in school would be the ones who would be disciplined, right? So all of these kind of political machinations as they are moving forward right now, I think cannot be separated from one another. And to have that holistic framework to say that we want real restorative practices, we want social and emotional learning, we want trauma-informed care, and a culturally relevant curriculum to uplift the experiences of those who have been pushed to the margins, Black and brown children, LGBTQ young people, and kids with disabilities, among others. You know, that is a way that any excess funds can be spent, right? As they make their way down from the federal government to the state government, let's say through the Texas Education Agency, all the way down to your local school district, right? And this can be a framework that really prioritizes the healing and the ultimate success of young people as we, again, go through this pandemic and try to get to the other side of it. With that, I'll turn it back over to Brennan to reflect.
I think we're going to jump into the Q&A. We had a couple of sort of comments on the Facebook feed. And I'm just going to start with the first one. One was sort of a suggestion of dealing with some of these issues with Medicare for all, and sort of talking about how people with no money, no insurance will not go to doctors. I mean, as an organization, we have not done the kind of federal advocacy that would be Medicare for all, but I think that expanding healthcare access is at the heart of several of these recommendations that we put together, and I think is really important. So mental health and substance abuse were sort of highlighted, but many local governments are also spending money on just getting vaccines done and masking and doing all the kinds of things to try and make it COVID specific remedies available. There was another question about discriminatory lending in the PPP program, which was a program that helped provide support to businesses at the beginning of near the beginning of the pandemic, and how CDFIs might address some of those business issues. There's also some general comments about how small businesses are needed to provide jobs and that kind of thing. Anne, are you able to talk a little bit about CDFIs and how that might apply to those kinds of programs?
Yeah, I'm happy to, just to offer a few comments. I think that the person who's asking these questions, they're right on point. There were a lot of problems with the rollout of the PPP program, and particularly in terms of reaching the kinds of businesses like sole proprietors and smaller businesses and businesses that were owned by individuals of color who may not have had robust pre-existing financial service relationships. And so just as an aside, we conducted a study and found that payday lenders and high cost lenders actually were some of the early recipients in Texas of PPP loans. So there were clearly problematic issues in the rollout. I think that it improved over time, but there's still a significant need for low-cost capital in communities to recover from the pandemic. And CDFIs are well positioned to do that. And it's one of the reasons why we are advocating for additional funding for CDFIs. About $47 million has come down from the Department of Treasury to Texas CDFIs, but communities need so much more. And with a loan loss reserve fund or some kind of a strategy like that, an investment from a city can be leveraged to bring in additional funding to the CDFIs to offer low-cost capital. And cities can be very deliberate about where that money is invested to ensure that it gets to communities that need it the most and communities that suffered the greatest hardship from the pandemic. And parallel to the small business lending issue is the consumer lending issue. It's in general an access to capital issue in communities that have traditionally been left out of formal banking services. And we hope that this can be an opportunity to infuse low-cost capital to help people rebuild their lives, rebuild their businesses, and support a lot of the goals that are framing this conversation around equity and rebuilding family resilience.
Great, thank you, Anne. We also have a question about access to healthcare for youth. I think that's what it was referencing. And I think we talked a little bit about just the things that would be helpful in terms of mental health and substance abuse. All of that applies to youth as well, who often experience those issues and are not well treated for it. And I think whatever we can do to expand that kind of access would be great. So, and we do talk about it in the juvenile justice facilities, how it's needed to, how these kind of community programs, alternatives to incarceration, are really important in that context. There was also a question on, or it's a comment saying, that crime has increased in neighborhoods, and it is there's still a lot of, it's really hard to get real data about crime, but what we've seen is that a lot of times theft and sort of property crime has gone down, but there has been an increase in violent crime, even most often shootings, but also homicide have been really serious and concerning issues. And I will say that the kinds of programs we're talking about, many of them actually impact crime. And there have been studies that show that reducing evictions and reducing housing instability reduces crime too. Mental health and substance abuse have been directly, providing treatment for that directly reduces crimes, even violent crime. The kinds of things we're talking, direct cash assistance, sort of removes some of the reasons that people can end up committing some kinds of crimes. So it is we specifically didn't call for more policing, partly because policing is not always the solution to everything crime related. Long term, it's definitely not the main solution that we'd like to put forward. I think that and putting more resources into these kinds of crime prevention strategies is really important. And also just in terms of like just fiscal accountability for governments, putting more money into police is you can't, under Texas law, a city that increases its police budget can never decrease it. And so if they use ARPA funds to increase their police staffing, it might very well lock them into that even when there's no money. And then that starts to impact all the other services that we depend on cities and counties to provide. So we have a comment about assistance around barriers for people with criminal records. Maddie, do you feel like you can talk about that a little bit?
Sure, and I can definitely, I think another question was about, landlords aren't accepting people for housing, even when they can afford it or after receiving these benefits. And, I wanted to start by just acknowledging that these are all huge systemic issues. These are all racial justice issues, economic justice issues. This kind of, this has been going on for a long time, and it can feel really overwhelming to sort of look at the disparities, perpetuated by the pandemic and the response to it, and see that the same communities are just getting hit over and over again and really pushed back over and over again. So one of the reasons we think it is so critical to push equity with these funds, to push targeting the most affected, to push closing these gaps, is that, not only is this money, and it's significant money, should be used for that, but also, hopefully we'll set a pattern, and that we'll see real results from it. And, it's not going to solve, 400 years of, racism and discrimination and our country's attitude towards poor people. But we're really hoping we can use this money to take some steps forward. So, there are both eviction records and criminal records are real barriers to housing. Landlords will also often have blanket bans on anyone with an eviction on their record, anyone with any kind of criminal record. And Texas, unfortunately, is not a state in which tenants have very many, if any, rights. So, particularly related to this money is going out too slowly. Even the money Texas already has for eviction prevention and rental assistance is moving too slowly. And the assistance needs to become before a case is filed and not after, to keep it off people's record. The Texas Supreme Court eviction diversion program actually contains some provisions that if the landlord and the tenant agree to apply for the funding, the case is kept confidential, so it doesn't appear on the tenant's credit report. We supported a bill during session that would have expanded that kind of confidentiality of evictions, particularly certain kinds of evictions, that did not pass. But we hope the success of the eviction diversion program, which we're the jury's still out, but Texas is actually spending money faster than a lot of places, will show how important that is. You know, in you know, the cases of both criminal records and evictions, you know, I think really there's a lot of agreement from advocates that landlords need to do individualized assessments. You can't just say, you know, you've been arrested once, we've got a blanket ban on it, or, you know, not take into account, you know, the rest of someone's life and what they've been doing. I mean, I think same for evictions. You know, someone who lost their job during the pandemic and was evicted, you know, that should be taken into account when landlords are looking at future future housing. Yeah, and I mean, I you know, and I think the other thing around rental assistance and mortgage assistance is that if landlords are refusing to accept it or evicting people despite getting it, we need, one of the program adjustments may need to be giving that money to tenants directly, and letting them use it to move, rather than paying a landlord who's just going to evict them either way.
Another question from the Zoom was, have you seen any proposals for state spending that might not be the best priorities? And I'm taking a look at this. I am the proposal from Senator Nelson has a lot of good items on it, but the biggest expense that she puts in is about half, a little less than half of the funding for the state going to replenish the unemployment compensation fund. And this is a fund that is basically pays for people's unemployment. And usually it's funded by taxes on businesses, especially businesses that lay off a lot of people end up having to pay more for unemployment in the future. And I honestly think that this is basically tax relief for a lot of business, and it's not very well targeted to the businesses that probably need it most. And so I think that this is probably not the best use of that fund. So that's 7.2 billion of the 15.8. I think that that's probably a mistake to put that much money in sort of not very well targeted business relief package. There are businesses that deserve some relief and need some relief, but there's ways to do it that don't just sort of blanket give out that tax break. That's the main one that I've seen. I mean, many of the others look very useful from the state on the state side. So
yes, I will say, Brandon, I will add that some of the other ways that the state is looking to spend the money is hospital surge staffing, salary for state employees who are working directly on pandemic response. They are looking to put in about 500 million into broadband expansion, 500 million into construction projects for higher education. I'm not quite sure what that covers just yet, but you know, depending on how it's spent and what it's spent for, it could be very useful in some of our higher education institutions. Looking at some bolstering of cybersecurity, which is something, if you're interested in thinking about online security, looking a little bit more into the fair financial services work that Anne, who popped in earlier, mentioned is becoming more and more important, especially as we saw things going on with Facebook yesterday and their related entities. And there are a number of other areas where there's some significant funding, but those are just an idea of some of the ways the state is considering them to spend the funding that they have as far as the 15.8 full billion goes.
Great. I don't see a lot of other questions. There was a nice comment saying that Hispanics are the largest community in the country in Texas, yet the dialogue is generally Black and white. And she appreciates that you all are mentioning the brown community. they're hardworking and all they want is to support their families, and that our presentation is helpful. So we appreciate that, and we think it's important to acknowledge that. So let's go ahead and move to the next slide. The final slide is on resources. Anyone who attended can get this list of resources. We have our recommendations. There's a home coalition that came out of Houston. They came up with a set of recommendations. There's a group called the Alliance for Safety and Justice that has a number of criminal justice related recommendations that really does dovetail pretty nicely with a lot of ours, and so on. There's quite a few resources there. I'd also just like to say that anyone who's interested in working on these issues on their local level, we are interested in helping. If any of your interests and your coincide with any of these issues, we are putting together kind of where most of the big cities and counties of Texas are spending their ARPA money so far. And if you're interested in pushing something that's along these lines, we're interested in working with you to help. And so just reach out to Christiane Caballero, who has been in the background facilitating a lot of this, and her email is down on this slide. But with that, unless there's any last minute questions or thoughts, we really appreciate everyone's time, and we look forward to continuing this dialogue about this really big source of federal funds that cities and counties have to figure out now. So, thank you. And thanks to all the panelists who put a lot of time and effort into these recommendations and their presentations.